Welcome back to Arizona Daily Mix. Today is National PTSD Awareness Day, and it affects 24.4 million Americans at any given time. Those who have it are between 2 and 4 times more likely to battle addiction. So it's very important that we know what the symptoms are and ways to treat and manage it. David Larimer is here. He's the program director of Scottsdale Recovery Center. Nice to have you here.
Thank you for having us on.
Appreciate it. So let's talk about what is PTSD for folks who are not aware of what it is.
So just some backdrop information. So at any given time, 70% of Americans experience at least one traumatic experience in their lifetime, about 223 million people. And of those people, in a lifetime, 44 million will have, or 20% of those folks will experience post-traumatic stress disorder. So PTSD, up until 2013, was part of an anxiety disorder. And one of the things that we in the profession, the behavioral health field, utilize to determine a disorder is called a diagnostic statistical manual. So in 2013, it actually had created its own category of stress and trauma-related disorders.
So it can result from a traumatic event. Talk to me about the symptoms and how you know if what you are suffering from is PTSD.
So those that have PTSD typically have experienced either a shocking, scary, or dangerous event. And according to the DSM diagnosis, you have to experience the symptoms for at least a month. Sometimes it can manifest itself within 3 months. Sometimes it takes years to manifest itself. Sometimes the course of treatment can last 6 months and alleviate. Sometimes it can be years and chronic. So some of the symptoms would be re-experiencing the event, such as nightmares, flashbacks, scary thoughts. Another symptom would be avoidance. You avoid the actual place, the people, or the objects. You avoid the thoughts or the feelings. You'll have mood and cognitive symptoms, such as difficulty remembering the event. You'll have
depression. Right.
Depression and substance abuse is part and parcel, as well as 1 or 2 different types of anxieties.
Trouble sleeping.
Right, absolutely. You'll have some arousal and reactivation symptoms, such as trouble sleeping, difficulty remembering the event, easily startled, anger outbursts.
You talked about substance abuse, and we know that people with PTSD are at risk for higher use of cigarettes, alcohol, and marijuana, but those who get treatment have a better chance of overcoming those situations. How do you go about treating PTSD, and is that also including management of it? Is it 2 different things?
Sometimes the PTSD can actually alleviate itself completely. Sometimes it takes years. So at Scottsdale Recovery Center, we use evidence-based practice like talk therapy, group therapy. We also use specific EMDR, which is eye movement desensitization and reprogramming. That deals with the past events. It deals with the current disturbance and future actions. And it basically teaches a person to address and live with the distress.
And how long does somebody usually get that treatment in a place like the Scottsdale Recovery Center? How long are they there?
Well, the National Institute of Drug Abuse put out 13 principles of effective treatment and indicated that 90 days is a minimum for treatment. Now, that doesn't mean you have to be in residential or a particular type, so you can have several different treatment, medical detox if you're addicted, residential, and then outpatient.
So you don't just obviously treat PTSD. There are other situations that you treat at the Scottsdale Recovery Center. What are those? The
PTSD typically is accompanied by depression and anxiety, and substance abuse. So we call that co-occurring disorder, which means you have several issues. Typically, you'll have medical issues with folks with post-traumatic disorder. You'll have folks that have lost jobs, so part of our responsibility is to help them re-engage into the community.
Well, we appreciate you being here in the community. Unfortunately, we're out of time, but it's scottsdalerecovery.com. And of course, we have that link on our website, aztv.com. Thank you so much for being here.
Thank you very much.
Great information. We'll be right back.